My name is Sabrina. My son's name is Jackson Ray. He was born at 26 weeks and we spent a total of 5 months in the NICU. To me, self-care means just that, taking care of yourself and being intentional about taking moments to make sure that you are okay. It was important to exercise self-care in the NICU so that I was healthy for my son. Someone told me that how I feel is projected onto him. Self-care for me also helped me to stay positive, stay healthy, and be strong for him. I like photography, so while I was in the NICU, I would think about concepts of pictures that I would take with my son once he got released. I experimented with it a lot. For me, it brought hope because I was preparing for him to come home. And it also was something that took the tension off of everything that was happening in the NICU. My advice to parents who are currently in the NICU is not to overlook self-care and not to feel guilty about making self-care a priority. It wasn't until I was in month 3 that I ended up in emergency because of being overly stressed. And it made me realize that I need to better take care of myself so that I could be there mentally and present to take care of my son.
My name is Abhishek. My son's name is Ian. He was born at 26 weeks and 6 days, and we spent 98 days here at the NICU. The forms of self-care that I practiced, one was absolutely being there in the morning rounds. So my wife and I would try to make it there early morning so that we could listen to the doctors and interact with them to talk about our son. The second one was at lunchtime, being able to go for a walk or sit down and eat together and just talk through our emotions and talk through what we had understood for the day. That was really important for us. Being in the NICU, one of the most important aspects of it was being able to hold my son and let him know that I was there for him. Being calm and just letting that emotion and that bonding happen, it was really important for me. My advice to dads specifically, as men, we're not always prone to talking about our emotions. We don't express ourselves. But I think it's very important in a situation like this, if you really want to be there for your child, talk to someone, whether it be a friend, whether it be a loved one, refocus and unwind so that when you are with your child, you're calm. When you're holding them, that sensation is going to be important for the child.
My name is Kathy, and my son Christopher was born at 27 weeks and 2 days. He spent 11 weeks in the NICU combined at Mount Sinai Hospital and Credit Valley Hospital. It's important to partake in forms of self-care because it's a big shift being in the NICU. I'm a first-time mom, and that in and of itself is pretty stressful, but being a NICU parent really amplifies that. For me, I practice different forms of self-care. One that I really gravitate towards is finding a way to connect with my old self again. I started taking myself out of the hospital, forcing myself to get out every day, and I found a local coffee shop just down the road called Jimmy's Coffee, where I would sit by the window, grab a coffee and a treat, watch people sometimes get together with family and friends and talk about anything but the NICU, just to give my mental state a little bit of a break. My advice to parents would be listen to what the hospital staff are telling you when they gently push you to grab lunch, go for a walk outside, even take a nap if you can. Do not feel guilty about caring for yourself. It is incredibly important that you do something for yourself each and every day so that you can be your best you.
My name's Marlene. My son is Asher. He was born at 30 and 1, and we were here at Mount Sinai's NICU for 57 days total, and the NICU's was 68 days. As a parent, if I don't take care of myself, I'm not going to be any good to my child. And that's basically what made me do it, because under other circumstances, I might not have. It was an incredibly tumultuous time, so it was very hard to think straight and think clearly and do logical things. But the one thing I was terrified of was becoming sick and not being able to be there for my baby. He was so young, and I'm a single parent, so if I wasn't there, no one was going to be there. I felt very much alone, and so I blogged. And blogging allowed me to stay in communication with my community and my family, to update everybody all at once, and also to receive back their responses so that I knew that people were actively listening and inquiring about his well-being and my well-being. My advice to parents in the NICU right now would be, number one, to use all the resources available to you. They're amazing, the social workers, the nurses. The other piece I would say is be gentle with yourself. If there's something that you can't do that everyone's urging you to do to take care of yourself, sometimes you just can't. So be okay with that you're not going to be able to do all the things you think you should do as a NICU parent.